Wanted to share a couple of things about tooth whitening. People are oftentimes interested in whitening their teeth. Has a nice, healthy, young look, and it's not something that is actually damaging to the teeth. If you have cavities, that does actually accelerate the cavity or the decay process, but assuming somebody has healthy teeth, it's really not a problem. There are really three ways of whitening your teeth. The first is crest white strips, and people are usually familiar with that. You can pick them up at pretty much any pharmacy or grocery store, and they have an active ingredient, which is hydrogen peroxide in a gel on a plastic strip, and you basically just apply those to your teeth, stick them on there, leave them on for a few minutes. Usually they recommend up to about 15 minutes, and they will slowly whiten your teeth. They're a little slow. They take a lot of quite a few applications, and the gel kind of gets everywhere. It's very goopy and gets all over the gums, which can burn the gums. So for those reasons, they're not my favorite option, but they are effective. Another option is to use an in-office whitening. And in-office whitening is where you come into the dental office, will apply a resin that will isolate the teeth, prevent any gel from getting on your gums, and then the gel is applied about every 20 minutes in successive treatments, and over the course of about 2 to 3 hours, we can whiten your teeth fairly drastically. The downside to that is it's 2 to 3 hours. It's kind of a long time to be sitting in a dental chair, even if you are watching a movie and you're comfortable. It's an event, so plan the afternoon. My favorite option actually is custom fit trays. They're similar to the first option, the crest white strips, in that you apply them at home. The difference is because of the custom fit tray, the gel doesn't have a tendency to get on the gums. The other advantage is that you can customize your result. And by that I mean sometimes certain teeth don't whiten as quickly as others. The canine teeth, for example, are a little farther back. They're a larger, thicker tooth, and they take more whitening gel to actually see a result. So what you can do with the gel is actually apply it just in those wells where those teeth are at, the canines or whichever teeth don't happen to actually be whitening as quickly, and you're able to get a more even result with that. The other big issue is sensitivity. Many people who've whitened their teeth will say that they've had some sensitivity. I know I've noticed that in the past. Currently what I'm doing, and I think works quite well, is to use the custom fit trays, and I'll just work it into my morning routine. So take a shower each morning. That takes about 5 to 10 minutes, and I'll put a little gel in the tray, pop it in, take my shower, get back out, brush my teeth, and because it's a short time frame, I haven't experienced the sensitivity that people oftentimes do. The other thing is I can use it for 2 or 3 days in a month, or maybe just for a week each quarter, or maybe twice a year, and that's plenty to keep my teeth looking nice and white. The other thing about whitening gel is that it does make your teeth more porous, and just for a period of time. The saliva has a natural ability to strengthen the enamel and actually add calcium and other minerals back to it. So it's not damaging your teeth, but you are actually making your teeth more porous for a short period of time. So if you have a tendency to drink coffee or tea or other things that have color to them, maybe red wine, they actually will cause your teeth to darken a bit, and over time it can take longer to whiten your teeth, and the effect won't be quite as drastic. So the best way to think about that is separate in time the whitening from maybe your red wine, for example. So what I would do is maybe whiten in the morning and then not drink any red wine until the evening time. It's a little more difficult with coffee, but what you can do is maybe drink your cup of coffee in the morning first, and then follow up by doing your whitening. I hope that helps. Thanks.